The client who would benefit the most from minimal opposition therapy is a child with a mild to severe phonologic speech sound disorder with no other developmental delays. Minimal opposition therapy targets the substitution of one phoneme for another. Minimal opposition therapy is most appropriate for clients who are stimulable for the target sounds. This approach is effective for school-age children with consistent phonological speech errors.
During the initial meeting with the client, a standardized diagnostic test, such as the Hodson Assessment of Phonological Patterns, 3rd edition, and a speech sound sample would be collected to obtain the child's inventory. The information collected from this, such as phonemic and phonetic inventory, would help us obtain baseline.
Target selection is based on phonemic substitution errors. Within the phonemic substitution, we need to determine if the variation is due to a change in placement, voicing, or manner. Selection of target sound should differ only by one characteristic or cognates. Early developing sounds have priority over late developing sounds. Selection of target sound should be based on what sound affects the client's intelligibility most.
Step 1. Discussion of words. For this step, the clinician needs to be certain that the client understands the concepts of the words presented.
Good morning, Lauren. Are you ready for your first activity? Yes. Okay. I'm going to describe some pictures, and then you're going to point to the correct picture. Okay. This is something you open a door with. Very good. You pointed to key. This is something you drink. Very good. You pointed to tea.
Step 2. Discrimination testing and training. During Step 2, the client's discrimination between two sounds is tested. The clinician repeats two words in random order, and the client is instructed to point to the respective picture. Each picture needs to be selected 7 times to be certain the client can distinguish between the two sounds.
Now, I'm going to say the word, and you point to the correct picture. Tea. That's not quite right. This is key. I want tea. Point to tea. Very good. Key. Awesome job.
Step 3. Production training. This phase is directed toward the elicitation of the minimal pair words. The client is instructed to be the teacher and say the word when the clinician is pointing to the picture.
Now, I'm going to point to the pictures and you say the word. Okay. Key. Very good. Tea. Awesome.
Step 4. Carryover training. Once the client can accurately articulate the target word, it can be added into a phrase or sentence. For example, a key, the key, touch the key.
Now, I'm going to say some phrases and sentences, and you repeat after me. Okay. A key.
A key.
A tea.
A tea.
The key.
The key.
The tea.
The tea.
Very good. Touch the key.
Touch the key.
Great. I like tea.
I like tea.
Great job, Lauren. You've worked so hard today, and now you get to pick some candy out of my candy bowl.
Thank you.
You're welcome.
We would record the session via audio and later analyze. We would not want to record data during the session because we would not want to create a time break or a distraction for the client. We would later record the data on this spreadsheet.
Minimal contrast therapy has several advantages. First, the child can learn to discriminate between the meanings of words. Another advantage is that the clinician can target consonants or vowels and in any position of a word. Minimal opposition therapy also addresses form and function of a word.
A disadvantage of minimal opposition therapy is that clients who struggle with sound distortions and assimilations cannot be adequately addressed using phonemic contrast. Clients who display a large number of these errors would probably not benefit from this therapy. This therapy is only geared toward substitution errors.